Welcome back and thanks for staying with us. Health Minister Dr. Christopher Tufton says more than 36 Cuban healthcare workers decided to stay in Jamaica after the decades-old bilateral agreement between the countries came to an end. We have the details from Jamila Maitland in this Primetime News follow-up.
Some 42 Cuban doctors have taken up direct contracts with the government of Jamaica to work in the public health sector. Minister of Health Dr. Christopher Tufton says a surprising number of Cuban healthcare workers have shown interest in the new working arrangement.
Having been here for a period of time, have expressed their interest to have permanent status, which is allowable under the law once you live here for a particular period of time. And there are some that have been here 5 years or even more in some cases. So we would certainly treat with that based on those that have applied and expressed an interest.
The revelation comes amid the termination of the Cuba-Jamaica medical program in March. More than 260 Cuban healthcare workers were engaged. Majority of them have gone back home. The Cuban eye care program was one of the most impactful under the agreement. Of the 18 doctors who were integral in the services at the St. Joseph's Hospital, just about a handful stayed. Dr. Tufton acknowledged that it has no doubt resulted in a bottleneck for screenings and surgeries.
We experienced a slowdown in some of the programs because of the departure of most of the Cubans. So the Cuban eye care program at St. Joseph's had to be slowed down. Of the 18 that were manning St. Joseph's, 6 of them actually stayed back. And there are others that indicate that they want to.
The Kingston Public Hospital also has a similar program. However, doctors there too are overwhelmed because of the departure of the Cubans who also worked in other disciplines.
It is true that the wait time is a little longer now than what was the case before, and we're going to try and ramp that up. There are some shortages in terms of radiology, so cancer treatment, because we had Cubans both at St. Joseph's and in Montego Bay, and we're actively trying to recruit.
The health minister says the government has been making efforts to fill the gaps by recruiting healthcare workers from other countries. The government has signed MOUs with the Philippines and Ghana. On Monday, Minister Tufton said it signed an agreement with India, the latest country so far.
It's going to include the possibility of rotation of clinical personnel coming here, those that are short. It also involves exchanges and training. So I do hold out a lot of hopes for that.
Jamila Maitland, TVJ News.